Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patch hair. However, with increasing in pollution and the stress in our work life, we are now seeing young people also complaining about hair problems. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today, we have with us Dr. Sagar Makhija, is a well-known dermatologist and has been practicing medicine for over many years now. He is MBBS, MD Skin and Hair, specializes in dermatology, cosmetology, and tricology. Currently, he is practicing as dermatologist at Dr. Sagar Makhija Clinic, Ulhasnagar. Dr. Sagar has dedicated his career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this show.
Yeah, thank you so much for the wonderful introduction.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are going to talk about like hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, irrespective of gender and age, is hair loss. So with your
Yeah.
profound experience, please can you enlighten us today what's normal and when to be concerned for?
Okay. So that's the most common problem being faced by patients. Before starting, I should let the viewers and audience know the term of there's difference between the term hair fall and hair loss. So hair fall is just temporary shedding of hairs, and hair loss is a persistent thing where this persistent hair fall can cause hair thinning and baldness. So both are the different terminologies. And normal hair fall in a day is around 50 to 100 hair fall per day. That is normal. But if a patient is, or if anyone is suffering more than is getting more than 100 100 hair fall per day, that's an abnormal thing. So at that time, patient should be concerned and they should seek a dermatologist help. Yeah.
Okay, doctor. So now that we know like when to be concerned for another very like जिसको भी हेयर लॉस का प्रॉब्लम होता है वो हमेशा एक सवाल
Mm,
खुद को पूछता रहता है लाइक मुझे ही
mm,
क्यों हो रहा है ये मेरे
mm.
साथ ही क्यों है so what are those general causes because of hair loss happen.
Yeah. So there are many causes for hair fall and hair loss, and for most important cause is genetics. अगर patient को काफी early age में they are noticing recession of frontal hairline or there are few bald patches or hair thinning, so in such cases the genetics is the most important cause. And in such patients, so genetics, because of this there will be increased hair thinning and it can result in male or female pattern hair loss. So hereditary, or if there is a family history, the patient should be aware of that thing. Secondly, the other causes for hair fall and hair loss are there can be hormonal imbalances, such as in pregnancy and lactation, there a patient can experience severe hair fall. Also, nowadays, PCOS or polycystic ovarian syndrome is most commonly seen in young teenagers. So that can be an important cause for hair fall. Apart from this, if the patient is having any thyroid issues like hypo or hyperthyroidism, that can also cause hair fall. Apart from this hormonal causes, there can be certain illness or medications which can cause hair fall. Like, excuse me. Yeah. So there are certain medications like if the patient is on any chemotherapy drugs can cause hair fall, and if patient is taking also if patient is having overexposure of vitamins like vitamin A, selenium, that can also cause hair fall. Apart from this, normal causes which anyone can avoid. This is related to hairstyle and your hair hygiene related. So if there is overuse of excessive chemical agents like bleaching or Botox can damage your hair fall and damage your hairs and cause hair fall. Also, excessive use of shampoo containing paraben and sulfate chemicals can damage your hair follicles.
Okay.
And apart from this, overuse of any heatening therapy can also cause hair fall on a long-term use. And also, there is one more important cause, that is chronic physical or emotional stress. If patient is
Mhm.
suffering a stress from a long-term use, it can cause hair fall. And if patients there's deficiency, nutritional deficiency, which is very common in Indian population. If the patient is having a diet which is deficient in iron, zinc, omega-3 fatty acids, that can also cause hair fall. Yeah.
Okay, that's very interesting. That so many causes are like affecting people, and some of us like blindly taking some pills, and we even don't know that
Yeah.
it is affecting our health. So, doctor, nowadays, like we are all stressful and we work like
Mm,
we are overworked, and there is like
mm,
late night sleep and
mm,
eating whatever is available. So,
mm.
can a personal lifestyle play a role in hair loss?
Yes, definitely. So the thing is, if the patient is having such a poor or unhealthy lifestyle, then over a long term it can cause the hair fall problem. So lifestyle means if there is a lack of good quality sleep, and if the diet is not good, in a good that is not a balanced diet in rich in multivitamins and proteins. If he's having a sedentary lifestyle, and if there is more eating exposure from outside food, or you can say some kind of street foods, and
Mhm.
if there is overconsumption of smoking and alcohol, such things can cause your hair fall problem. Yeah.
Okay, so even lifestyle is equally important for health of
Important.
hair,
Yeah.
not only for body and mind, but also for the hair.
Mm.
So that's
Yes.
very interesting, doctor. So doctor, now अब जब हमें पता चल गया कि that lifestyle is important, hair loss क्या होता है, causes क्या हो सकते हैं, तो दूसरा like because of this era of this internet and so many
Mm.
information, people are quite
Mm.
confused कि मेरे लिए क्या treatment सही है. So
Mm.
please can
Mm.
you enlighten like what are those medical treatment available for
Yeah.
like hair loss, whether it is surgical, non-surgical, or any oral or
Mm. Mm.
topical? How like how should one go
Yes.
from the first line to the final stage of
Final
treatment?
treatment. Yes. Yeah. So that's the most important question. And so basically, if the patient is suffering anything, is suffering from hair fall or hair loss in terms of hair thinning or baldness, they should consult a qualified dermatologist consultation. So after proper checkup, we can come to know whether it's an you can say acute telogen effluent or just temporary hair fall, or it's a more long-term hair condition.
Mm-hmm.
So based on the diagnosis or the proper selection of the patient, we can start the treatment accordingly. If it is telogen effluvium, which is the temporary shedding of hair, mainly seen in pregnancy, lactation, or any stress-related condition, so this
Mm-hmm.
can be recovered within oral treatment within 3 to 4 months. But if the patient is having, you can say, suffering from hair thinning or baldness, the treatment minimum should be continued for minimum, you can say, 6 to 7 months to see the desired results. So the reason behind this treatment, long-term treatment, is that the normal hair cycle is around 3 months. So whatever treatment we are starting, we have to continue for minimum 3 months to see the desired results. And if we are going for the treatment part, so there are two types of treatment, which is surgical and non-surgical. In non-surgical treatment, it's either medical treatment and non-surgical medical treatment. So in medical treatment, there are two options. First is an oral treatment, and second is the topical treatment. So in the oral treatment, we start the patients on multivitamins or nutraceuticals, which depending on the condition of patient. And secondly, we can start oral finasteride, which is an FDA approved drug for hair thinning. Secondly, in topical, the FDA approved molecule is topical minoxidil, which will help in new hair growth or formation. And
Mm-hmm.
And secondly, topical redensil and other peptides can also be used depending on the hair fall condition. And apart from you can say non-surgical treatment, we so the latest treatment which is going on nowadays is platelet-rich plasma or GFC therapy, PRP, which will be equally effective and will act as a booster treatment apart from the oral treatment. And secondly, when there's one more treatment which is FDA approved for hair growth, that is laser therapy, low level laser red light therapy, which
Mm-hmm.
also stimulates the hair follicles. And if patient is having severe hair fall, maybe in stage 7 or 8 of male pattern hair loss, then they are advised the hair transplant treatment, which is the last and the treatment option available as a surgical treatment. Yeah.
Okay, that's very informative, doctor. Like,
Mm,
if nothing works, then there is always a surgical option available instead of
mm,
people thinking that okay, maybe I'll
yeah.
it's
Mm-hmm.
feeling like underconfident. Okay,
Yes.
so doctor, another very word called nutraceutical is getting a lot of focus nowadays, and
Mm,
people are eating those
mm,
nutraceuticals. So, what
mm,
are
mm.
the role of this nutraceutical? What is it, and is it really helpful in hair loss problems?
Yeah. So the term which is going increasingly popular nowadays is this nutraceuticals, and it has been something. It's there are some misconception among the normal people also. So this you can say these are drugs which are food based medicines and which help in giving nutrition and which provide health benefit to the patient, and it will help in preventing and treating a disease. So examples of this are, you can say, omega-3 fatty acids medicines, which also medicines which are rich in antioxidants and probiotics. So so if the patient is suffering from any hair fall, and such medications which are doctor recommended should be considered by the patient. No, there should not be any self treatment, because there are many products available over the counter also, which
Mm-hmm.
will have just they will means you they will just market it as hair supplements or something, but they won't be much effective. So it's better to consult a doctor in such conditions. In such medicines we look for essential vitamins and minerals which usually are lacking in our diet, and so such vitamins and minerals are provided in the form of tablets to the patients. Yeah.
Okay, so doctor, there are so many these herbal and these plant
Mm,
constituents. Are they
mm,
really helpful in managing this alopecia?
mm. Yes. So there's a big thing about, I can say, about rosemary oil, which many patients also ask us whether it is effective or whether we should use normally. So there's even, I can say, there is some hype regarding such herbal products. Overall, any hair oil, I can say that it won't help in hair fall or hair growth. Obviously it won't help, because there is no oil which will penetrate inside the scalp. And so rosemary oil, there are some studies which shows that it helps in some kind of hair fall, but just like a normal oil, a patient can use it. There were some so we need some good studies to support this evidence. Secondly, one thing which is plant-based products which are useful, I can say that's omega-3 fatty acids.
Mm-hmm.
So omega-3 fatty acids are included in some in products like fish products in fish, and if in vegetarian sources it is present in walnuts, flax seeds, and chia seeds. So these things are very helpful for hairs, because omega-3 fatty acids will they will increase the scalp circulation. It will also decrease the inflammation in the scalp if present, and this will help in normal hair growth, and also it will prevent dryness towards the scalp. So this is an important thing which patients can take over. Yeah.
Okay, very interesting, doctor. So, doctor, so these nutraceuticals are helpful, but nowadays, like people through the information which is on like the internet, they just
Hmm.
follow. they pop the pill and pop the pill. So, is it
mm,
required to take these nutrients as per gender RDA requirement, or is it required to take under the supervision of doctor? What do you think?
yeah.
Like, what's the right way?
Yeah, so this is also the most important thing which I would like normal patients to know about it. So there are many products which are marketed as health supplements or gummies, but actually we can see that they are not much. They won't be much effective for hair fall and hair growth. So
Mm-hmm.
whatever the products which are prescribed by the doctor, the patient should always consider that. Yeah.
Yeah. That's interesting, doctor. So, doctor, like after like we have covered like hair loss, we have covered the
Mm,
treatment, and we
yeah.
have covered so many other stuff. But another very common problem between all of us is like dandruff.
Mm,
And
yes.
dandruff के ऊपर कोई बात करना नहीं चाहता, and people
Mm,
is like keep hiding their dandruff. So, can dandruff
mm,
also cause hair fall? And is there any
mm.
treatment for dandruff also?
Yeah. Yes. So so dandruff directly cannot cause any hair fall, but indirectly it can cause hair fall because if dandruff is present from long time, the patient there will be continuous itching and scratching, which will
Mm-hmm.
you can say damage the hair follicles.
Mm-hmm.
Also, if patient is suffering from different kind of dandruff like seborrheic dermatitis or sebopsoriasis kind of, in this conditions there is inflammation in the scalp, so this will eventually cause hair fall problem. So it's
Mm-hmm.
better to consult a doctor. So on the basis of dandruff, you will be prescribed a good shampoo which will help in controlling the dandruff part also. Yeah.
Okay. So, doctor, nowadays we are like we have talked about lifestyle. In lifestyle, we also talked about the stress part. And
Yeah.
whenever we are stressed or we have a dandruff, so there is one formula which is given by all our grandmother कि भर भर के
Mm,
oil लगा लो, dandruff
mm,
चला
mm.
जाएगा, बाल लंबे और घने
Yeah.
हो जाएंगे.
Uh,
So, what is the fact behind this? Oiling hair is good or bad?
okay. So that's a bit tricky question, but my take is that hair oil has both advantages and disadvantages. Uh, so the advantages part of using an hair oil is that it provides a good nourishment towards the scalp and hair. It protects the hair from the external environment and pollutants.
Mm-hmm.
Secondly, it will increase the scalp circulation, which will increase the blood circulation, and you can there will be new hair follicles and nutrition supplements will be provided towards the hair. That's an advantage part. But my take is that if the patient is suffering from severe kind of dandruff, so they
Mm-hmm.
should avoid using hair oil, or they can just use it and just before the use of shampoo,
Mm-hmm.
because excess hair oil, if the patient is applying excess hair oil and if the patient is already having dandruff, then this will increase the flakiness part and the inflammation part, and this will promote more hair fall problem in future. So it's both sides of a same coin, you can say. So depends, okay, if the patient does how is the scalp, so we can then justify whether the hair oil is good or bad for the. And also I would advise that if the patient wants to use hair oil, they can use it minimum around 2 to 3 times a week, not daily and aggressively, which will can cause hair fall on a long term use. Yeah.
Okay, so it is always good to go to the doctor and at least get to know that how your
Mhm.
scalp is. Like
Yes.
just
Yes.
like we do yearly checkup, you should also go
Mm.
and ask your doctor
Mm.
that हमारा scalp
Yeah.
कैसा है instead of applying anything blindly or not.
Mm.
Interesting. So now, doctor,
Yes.
my favorite part, can you give us some important
Mm.
tips for healthy hair?
Okay. Yeah. So, lastly, I would say that there are certain do's and don'ts which every person can follow to maintain a good hair condition. So, what patients can do is that they can always follow a good healthy lifestyle. So, I've seen patients which have a good diet which is rich in vitamins, minerals, and proteins. So they
Mm-hmm.
don't suffer much from hair fall problem. So first is the diet part. Second is the diet should contain foods which provides them good quality and good source of proteins and also omega-3 fatty acids. Then there should the person should have a good 7 to 8 hours of quality sleep, less amount of stress, some kind of daily, you can say a bit of exercise in terms of any walking or just playing an outdoor sports is always good to maintain a good lifestyle. So this will also help in good blood circulation, and it will help in maintaining normal hair fall also. Yeah. And the things which the patient should avoid is that avoiding using over the counter products like shampoos which contain paraben sulfate. And if the patient is having dandruff, they should consult a doctor and start a good anti-dandruff shampoo. They should also avoid using harsh products over the scalp in terms of you can say there are certain bleaching agents which are available, or hair colors, or excessive use of hair straightening can also cause hair fall. So they should avoid this. And one important point is that always you should avoid combing your hair when the hairs are totally wet, because it can damage your hair shaft. So such there are certain do's and don'ts. This patient can follow. Yeah.
Oh, this discussion was very informative, Doctor. I really enjoyed, and I'm sure that the viewers must have also enjoyed the session. So, can we take some live audience question, Doctor?
Yeah, sure.
Okay, the first question from the audience is, "Hi, Doctor. I'm 35 years old, and I started seeing hair loss since
Mm,
last 5 years. And first my doctor asked me to use dermarola, and then she said me I should apply minoxidil. Still I
mm,
have a lot of hair fall, and I'm also from last Nagar. Can you give me appointment? She said me PRP is better now. Should I go
mm.
for surgery, or what should I do?
Yeah. I would suggest this patient to it's better to consult a dermatologist and start the treatment, because in this internet world we can see many patients will just self-medicate and start this hair care products like minoxidil, and there are many patients which come after applying minoxidil for 1 to 2 months, then they experience more hair fall. So it's better to consult a dermatologist. Let's after diagnosis we can see which stage of hair fall, or if there is hair fall or hair loss.
Mhm.
Depending on that, we can start the treatment. And medical and PRP can be combined treatment. This should be continued for minimum 4 to 6 months to see the desired results.
Mhm.
And also there's a take with minoxidil is that it should be, I think it should be always prescribed by a dermatologist only, and the patient should start then and only when it's required, because once minoxidil is started, it has to be continued for long term, for you can say for your whole life to maintain your hair quality, hair strength. Yeah.
Okay, okay.
Yeah.
Yeah, yeah. Some patients start losing their
Mm,
hopes. It's always better
mm.
to stay consistent and hope for the best. It's some
Yes.
because technology is getting improved, and I think it's always
Mm,
have solution for everything if they visit to the doctor.
yeah.
So I'll take another question from a viewer. Is Hi doctor, I am facing PCOD, and with my PCOD, I am started having hair fall. My doctor said it is because of stress. Do you think it is because of
Mhm.
stress, or I have some deficiency, or is it because of PCOD?
Okay. So PCOS has a direct role in hair fall and acne problem, and also hirsutism, where the patient can get increased hair growth over the face. So regarding hair fall problem, it's better to first treat the PCOS part. PCOS, the first treatment is the patient should follow a good diet and avoid foods which and good diet and exercise. So weight reduction is the first treatment. For PCOS, depending on the lab reports and the ultrasonography reports, we can start the treatment also.
Mhm.
There are some medications like myoinositol, folic acid, which will help in help in regularizing the menstrual cycles, which will take minimum 2 to 3 months. So apart from this, we can start a hair multivitamin also, and a hair serum apart from minoxidil, which will help in hair fall problem also. Yeah.
Okay. So I'll quickly take one last question because we are running out of time. Hello, doctor. What will be good for heavy dandruff?
Hair, dandruff,
Heavy dandruff. What? Matlab, I
heavy
think he
dandruff.
must be
Yeah.
asking for the treatment for heavy dandruff.
Okay. So it depends whether the patient is having which kind of dandruff, which you can just visualize with the help of lens and a scale for, with the help of examination. So
Mm-hmm.
if patient is having oily dandruff or dry dandruff, the treatment depends upon that. And good hair, you can say anti-dandruff shampoo can be prescribed, not the over-the-counter medications,
Mm-hmm.
which will help in resolving the issue. Yeah.
Yeah, and one of the viewer asked that how to take your appointment. I think Doctor works at Doctor Makhija's clinic. It's his own clinic at Nagar. You can Google and always try
Yes,
contact
yes.
him and get the appointment.
It's Radiant by the name Radiant Skin Clinic. Yeah.
Okay. So, fine, Doctor. Would you like to give any take-home message or any other suggestion to our viewers today?
Yeah, sure. So I think it was a very good interactive session, YouTube live regarding the hair care topic. So my take home away points for viewers will be that if the patient is having hair fall more than 100 per day or hair loss or baldness problem, they should always consult qualified dermatologist and start the treatment accordingly. So my takeaway message will be don't just start the treatment by looking over the just googling stuff or some just means self medication should be avoided, I feel. And because every product has their side effects also, you can say uses and side effects if used on a prolonged term. So
Mhm.
maintain a good lifestyle. Healthy lifestyle is important. Have a good quality sleep, avoid excessive stress as much as possible. And always I can feel that patients should check their scalp if they're having dandruff or not, and if dandruff is there, and proper treatment should be started accordingly. Yeah.
Yeah, so instead of becoming your own doctor, you should
Mm.
always go to the certified dermatologist for hair care. And thank you so much, doctor. I really enjoyed talking to you, and I want to go for like more and more questions. But yes, time doesn't permit. But thank you so much for taking out your time and answering all the questions of our viewers. And I'm sure the viewers have found the session very helpful. Thank you so much, doctor. It was
Yeah.
delightful.
Thank you so much. Much appreciated. Yeah.
And thank you so much, viewers, for joining us today and participating so actively. But yes, I could not take all the questions. But if our doctor has some time in future, we can take his appointment again and create more awareness about hair and skin. And until then, doctor, take care and have a nice day.
Yeah, sure. Thank you.
Bye bye, doctor. Take care.